we're going to cover in this video will likely have impact on whether pushing is a positive experience for you or you find yourself experiencing an episiotomy or tear or vacuum delivery. Now, this video is a masterclass on pushing. I am jam-packing with super valuable tips, information, and we're going to be debunking some myths. In addition, I'll be answering viewer questions, including the one from Jim, who accuses me of being wrong about pooping during pushing. Have you heard those birth horror stories about women breaking blood vessels in their eyes? Or how about those stories about people who have urinary incontinence for months after birth? Now, both of these can be side effects of something referred to as purple pushing. Purple pushing is known also by the medical terms Valsalva maneuver or closed glottis pushing. It's a style of pushing where you are direct coached, usually by your labor and delivery nurse. Now, the good news is that there are other options for pushing. Let's walk through what purple pushing or direct coach pushing looks like. Direct coach pushing generally looks like a nurse instructing you to take a deep breath in, to put your chin to your chest, and to bear down or push while holding this breath in, usually to a count of 10. Now, this strenuous process is repeated through the length of the contractions, which is generally 3 or 4 pushes per contraction. Now, if you've given birth before and you've experienced this type of pushing, you probably heard words like from the nurse, like hold your breath or push harder. And as you can imagine, this type of direct pushing style, it's really intense and it can cause your face to turn purple, hence the name purple pushing. And you might even end up with bloodshot eyes the next day due to tiny little capillaries that burst with that intensity. But there are 2 other pushing styles that I want to make sure that you're aware of before you're 10 centimeters dilated and ready to push. The first one is called open glottis pushing. This technique is where you take a deep breath in, but this time you exhale slowly while you bear down. And it helps to visualize directing this breath down towards your rectum and your vagina. And because pushing a baby out is so similar to pooping, you can actually practice open glottis pushing next time you're on the toilet having a bowel movement. Did I just suggest practicing pushing while pooping? Yes, I did. It's a great time to practice. So what it looks like is a deep breath in and then a slow exhale. So it could look like this. It could also look like the other option is to take a deep breath in and make a grunting or groaning or vocalization sound as you push towards that pressure feeling that is in your vagina or your rectum. Something like that. To recap, that's 2 other options, a deep breath and a slow exhale, or a deep breath and a grunting noise. Research done on purple pushing has shown that it can decrease the pushing phase of labor by around 5 to 15 minutes on average. But the American College of OBGYNs gives a clear recommendation to doctors to support the options that are working for the woman giving birth. Their exact recommendation is, quote, when not coached to breathe in a specific way, women push with an open glottis. In consideration of the limited data regarding superiority of spontaneous versus Valsalva pushing, each woman should be encouraged to use her preferred and most effective technique. What this means for you is that you should have the option to push how you want. Now, I said should there, because not all doctors, midwives, and nurses are following these recommendations. If you would like to avoid purple pushing in labor, I highly recommend talking to your care provider prenatally about your preferences and express these preferences on your birth plan. You could use this exact phrase on your birth plan. Quote, I would like to work with my body's own urge to push and prefer not to be direct coached during pushing unless necessary. And because there's research that says changing positions while pushing can also be effective at shortening the length of pushing, you might also consider adding this to your birth plan as well. Quote, I am interested in changing positions while pushing and would like to try side lying and upright positions. After learning about open glottis pushing, one of our viewers, Rebecca, left us a comment and said that she discussed this option with her doctor. Rebecca says, I asked my OB if I could do open glottis pushing today, and her initial response was, where'd you hear that? She clearly was not a fan of the idea, but ended up saying that we can try open glottis pushing, but closed glottis works better. And she added, it was an intimidating conversation. Now, Rebecca's experience, it's pretty common. As a doula, I've seen this scenario play out so many times where mom wants to use open glottis pushing or grunting during the pushing phase, and their OB or their labor and delivery nurse really try to coach her to stop. Now, I encourage you to do what feels right to you. If your way of pushing really doesn't work after you give it a really good try, then you can try closed glottis pushing. Some OBs and labor and delivery nurses aren't actually following current research and guidelines. And this can cause a really uncomfortable situation. But you know what? It's your body, and you're the one who is going to recover from a tear or experience a vacuum delivery. So I really encourage you to advocate for yourself and do what feels right for you, even if it's an uncomfortable conversation. Now, we received a similar question from Hannah. Hannah asks, why do nurses and doctors say don't make noises or scream when pushing? So this is also fairly common when doctors and nurses are wanting you to do more of a purple pushing or that closed glottis pushing. Then they're going to encourage you not to make noise. Now, screaming doesn't always bring forth the most power from each push, but speaking from experience here, it just might be what you need to do and you have to do. So do it. Here is an interesting question from AppleTree312. They ask, what happens if you don't push? Now, the cool thing is that your body, in many cases, can push a baby out on its own. There's something called the fetal ejection reflex, which will push the baby even if you don't give any effort. Sometimes when someone has a really heavy epidural, so they can't really feel anything, their body can bring down the baby without their knowledge that their body is actually pushing the baby out. It's really amazing. And when this happens, this actually shortens the pushing time, which is pretty cool. The other thing is if you are unmedicated and you don't have an epidural and you're feeling everything, sometimes it can feel like your body is pushing without you actually having any effort. Like your body is, just like that term, ejecting the baby. Next up, let's talk about what a lot of us wonder about and think about when we are talking about pushing a baby out, and that is whether we poop in labor and what are the details on that. Let's cover that now. Do you poop while pushing your baby out? Well, that's the big question, right? Yes, many people do. And the reason, while you're pushing the baby's head down, baby's head is compressing the colon, and sometimes if there's stool there, you're pushing that out too. Is it normal to poop while pushing in labor? It is absolutely normal and very common. What happens if I poop while pushing? Well, this is the really important thing to know, that usually your care team, your nurse, your midwife, your doctor, whoever is there and sees that you have pooped, they will clean it up, wipe it away, put it away, and usually not even say anything. They know that it's very sensitive. A lot of people don't want to hear about it, and so they try to just not make an issue of it because, frankly, to healthcare providers, we see it all the time and it does not even, faze us at all. So usually it's taken away. How can I prevent pooping during birth? Wow, this is like the question everybody wants to know. I know I wanted to know this too. What can I do to prevent it? Just tell me and I'll do it. And the answer is you can't. There's really no surefire way to prevent pooping in labor. So it's okay. It is okay. And Jim asks, if you don't want to poo during labor, why wouldn't you use an enema? My wife had one during inducing, then nothing happens except the baby comes out. He also adds, I've seen a woman poop on a baby during a breech birth while the mom was on her knees. Finally, Jim concludes by saying there's a couple of answers that weren't correct. So, oh, Jim, it's so funny how you are an expert about pooping during pushing when you are basing all of your knowledge on the one experience that you had with your wife. So as a doula who has been to over 300 births, I can assure you that your experience isn't how it always goes. And getting an enema doesn't always guarantee that you won't poop during pushing. Also, Jim's account of seeing a woman pooping on her baby during a breech birth sounds like something he probably saw here on YouTube, and likely he saw the baby pooping during a breech birth. This is very common because their butt comes out first and squeezes out poop. Next up, we're busting some of the most common myths, including whether you push continuously and what you actually feel when you have an epidural and you're pushing. My number one myth about pushing, and that is that you have to push in stirrups. This is the device that you put your legs in, usually during a pap smear. And you might see this in videos, and sometimes it's still used during birth, but this is not required for childbirth and pushing. When you are in that position, it doesn't usually bring back good feelings. A lot of people have negative associations with stirrups, and it also doesn't sort of give you that power behind pushing. You're a little bit more passive pushing. So another option would be to hold your own legs if you are pushing on your back, which leads me to the second myth, and that is that you have to push on your back. Oh my gosh, we see this all the time, TV and movies, people on your back or in a sort of a semi-seated position. Now, you definitely can push in that way, but there are a lot of other options. So if you have an epidural and you have absolutely no feeling in your legs at all, which is less common, you might have only two options for pushing. That would be on your back and on your side. But you do have the option of pushing on your side, and it's an excellent option to push in. So this myth of only being able to push on your back, it's just not true. And what I would say is if you are interested in pushing in different positions, definitely, again, talk to your care team, especially right before pushing, and say, I'm really interested in different positions. Now, if you're wondering, like, I don't really care, like, why don't I just push on my back? Sure, that's fine. But do know that changing positions can help speed up the pushing process, and even pushing on side lying can help reduce the incidence of tearing. So if you're interested in both of those things, reducing the likelihood of tearing and the likelihood of needing an instrumental delivery like with forceps or a vacuum, and if you're hoping to kind of speed up pushing, then you might want to talk to your care provider about not pushing solely on your back. Jumping in here to make sure that you caught that bit of important information. So you have the ability to decrease your chance of tearing and your chance that your doctor will need to use a vacuum to get the baby out if you push in a position other than on your back. So side lying is an excellent option for pushing with and without an epidural. So if you want to make sure that you get a chance to use side lying during your birth, I really recommend talking to your labor and delivery nurse about it prior to the pushing phase. So ask your nurse if they can help you make this happen. So speaking of pushing with an epidural, a big myth is that if you have an epidural, you won't feel any kind of pain or discomfort when you're pushing. Sometimes people even say, my epidural wore off because I felt so much pressure when I was pushing. That's not actually your epidural wearing off. That's just how an epidural works. It is very common that the epidural only covers and helps prevent that contraction pain, lessen the contraction pain. It often cannot take away the rectal pressure that you feel with pushing. And many people describe it as the most rectal pressure and the most intense rectal pressure that they have ever felt or could imagine in their entire life, almost like a bowling ball being pushed from their butt. And this is something that a lot of times the epidural just can't take away. So if you have an idea or believe the myth that the epidural will allow you to experience no painful sensation or no discomfort during labor, it is definitely something that can be uncomfortable. So it's good to know some coping mechanisms. I always recommend a childbirth class just if you experience any kind of discomfort, you have some ways to cope, especially with breathing. And I'm going to put a link down below to a childbirth class that I teach if you're interested in joining that. Okay. The next myth that we see all the time, especially in TV and movies, is that once you start pushing, that you push continuously until the baby comes out. And sometimes you hear people say, I push for 2 hours or 3 hours, and that's probably very true. But what we don't talk about or see is that you only push during the contractions. So just like in labor, you're going to have a contraction and then you're going to have a rest. You're going to have a contraction and then a rest. And with pushing, you only push during the contraction. The rest time, you're resting. So they never show that part on TV. They never show that you push for a minute and then you have maybe 3 minutes in between to catch your breath, have a sip of water, put a washcloth on your head, those kind of things, and then start pushing again. So there are breaks. It's not just like time to push and we're going to push continuously for the next 2 hours. I know when I found that out, I was so relieved. I couldn't imagine continuously pushing for that amount of time. Do you have a quick second to let me know what you learned in this video? Even if it's something tiny in the comments, it will help someone else and it'll help the next viewer. So before pushing, we need to dilate. And I know that most of us want to speed up labor. So I'm going to put my favorite video on speeding up labor right here for you to check out next. And I'll see you next time. Thanks. Bye.